And so to close out this session, we'll still have questions, but Dave's going to give us an update on CoxyWatch. So one of the things that's been mentioned here is the difficulty. We think this is airborne, right? We think we're inhaling it from the air, and yet detecting it in the air has been such a challenge. So I'm excited to hear about the update on this program.
Thank you, Bridget, and thank you to the organizers and the National Academies for pulling this great meeting together. I'm going to talk about a program that we've been working on for several years with multiple partners and give an update on our understanding of coxy in the air in endemic areas. But also with all the great talks, I want to try to save some time. I'm going to squeeze in to throw in some maybe provocative thoughts, some alternative hypothesis to bring a lot of this data together to understand what's happening with coccidioides. So hopefully we can get there. And I'll try not to go too fast. But the good news is that I mentioned that we're talking about a program with lots of partners. One of our great partners, the CDC, Dr. Litvintseva, is going to be talking tomorrow, really more about the details of how it all works. But okay, let me just lay this out. We really are thinking about coccidioides exposure risk. So I'm not talking necessarily about, we'll talk a little bit about cases here, but really trying to understand what is our risk for exposure, and is that the same everywhere? I think we've thought, I'm a born-bred Arizonan, been working on coxy. It'll be 30 years next year. And just thinking that in highly endemic areas like Phoenix, like Tucson, like the southern San Joaquin Valley, it's just somewhat omnipresent in the air. And so if that's the case, is the risk changed because of the seasons or because of the weather, and how does that actually lower the risk in the air? But we do have to think about the whole life cycle of this, and here's something from one of Morgan's earlier papers, but thinking about that whole model, how climate factors affect the abundance of coxy in the soil potentially, and therefore then later on the abundance of coxy in the air, which makes a lot of sense. And there's a lot of great epidemiologic history that shows us that when things cause coxy to get up in the air, it increases the risk. And we heard about a couple of those earlier. I'll probably hit on a little bit of that here in a minute. But we also really have to think about the stochasticity of coxy in the soil. It is, as we will see here soon, it is not omnipresent in the air. It definitely isn't ubiquitous in the soil, and it can be very focal. So we have to think about this on macro levels, macro endemicity, but also on micro levels, and how it is fairly stochastic in the environment. So wind and dust storms, this was just discussed. We do know, and I have the obligatory haboob moving through I think that's through Phoenix. It could be Tucson or Phoenix. The great example from Demo and Hans's paper of the massive windstorm in Kern County, the tempest from Tehachapi example, that where coxy showed up and blew out of San Joaquin Valley and was actually seen in the central coast of California. So clearly it can be carried in the air, but how important is that regularly, and how for exposure, and how important are these windstorms for dispersal? I want to hit a little bit on that. There was this great back and forth in the journals lately. Hopefully you guys have been following. This is a very interesting discussion, because I think it's a really important discussion for us understanding what is really driving our risk for coxy. So what we wanted to do was have a multidisciplinary approach to understand and potentially predict the exposure risk in a highly endemic area like the Phoenix area by monitoring coxy in the air and then comparing that to weather data, comparing that to other data layers, and develop this predictive model. And so we've been working with the Department of Health, Arizona Department of Health Services. CDC has been our primary partner on this and one of the leaders, but also working with NOAA and Department of Homeland Security and some other institutes as well, and I'll try to touch on some of these. This is the overall system. I'm not going to go through in detail again. Anna Litvinseva from CDC is going to discuss this more, but just so you can kind of see the layout, that map up there is Maricopa County, or it's the Phoenix area in Maricopa County, which is it's a very large, sprawling suburb for most of the Valley region. But you can see all those different collection sites. Those are all air filter collection sites. These air filters are 24-hour collections. I think it's about 100 liters of air a minute going through these, and these filters are collected daily. And then we had a significant subsets of these filters, which we were extracting and conducting PCR analysis for the presence of the coccidioides DNA. And then once we get that data, we can see the prevalence of cocci, the average prevalence of cocci in these filters, and then comparing them to weather and land cover data layers, and then try to develop a risk model from that. So what does the data look like so far? We've received about 10,000 filters. We've tested just about half of those filters processed, really looking at about half the sites. So working with Homeland Security, this is a system that they've put into Phoenix, like they've done in some major metropolitan areas, to look for other things that are maybe at higher risk, or actually maybe lower risk, but higher consequence diseases. These are the filters that we're also taking and looking for the presence of coccidioides. And so we're not getting every site, and we're not getting the exact information about every site, so it's a little bit of a secret squirrel thing from Homeland Security, but we are able to get enough information for us to understand generally what's happening across the valley. You can see the stars on that graph on the right-hand side. Those line up with the filters, the filter locations, which then map to this map, and if I click on that, you can see that's where the locations that we're actually using right now for this analysis. And then I'll go further into the graph on the right, which is really the results of the filter processing. In fact, let me just zoom in on that. What we can see is across the bottom, these are years. So we did a couple pilot tests, first in 2016, and CDC published this work towards the end of 2016, where we could see that we did not have even distribution of coccidioides. The red, the darker red, that is the prevalence of cocci across a week, and each one of those bars then I believe is a week, a week during that time period. So we can see some places consistently very high levels of cocci throughout those weeks. In other places it's spotty, in other places it doesn't even show up. And again, this is across the valley. Sorry, let me just back up. Then there was a couple more pilot projects, really CDC and TGen working together to make sure all of our methods were comparable, because they did literally half the work, we did half the work, and have combined these data sets. And so then what we're seeing, the remainder for 2018 and 2019, those are all the filters that were processed over really this 18-month period. There are some holes in there. Some of that is just because they were not being made available to us. And sometimes those bars for each individual site are a little bit smaller. That just means we weren't able to test every sample from those individual weeks. But again, we're seeing a same trend where we're seeing not only differences between sites, we're seeing differences across time as far as the presence of cocci on these filters. And in some locations at the top there, where it was very high, really became more medium level, where we still had several weeks throughout the year where we were definitely getting positives. But maybe the second red bar here, you can see we went from very high back in 2016, the fall of 2016 during that pilot, to almost no presence during the study period for those 18 months. And then other places just remained low throughout all of that. So that's actually we think a really important finding, is that we're seeing that there is, across time and space, we're not seeing any necessarily consistent results, although we do have some hot spots. So for instance, what we're seeing here in the colors on these filter location sites, and these are just general locations where the filters are somewhere within those circles, but we can see different parts of the valley. We can, hopefully, there we go. We can see here the two-way site seems to be, have high levels of COXY, an average of, that's 29% presence on filters on a weekly basis, 17% in 2019, so still very high levels, whereas we could see in these green, relatively low levels at right about 1% here up in the Northern Valley, Scottsdale area, or getting close to the Scottsdale area. We're not seeing really much COXY in this region. Then we see really drastic changes down here in the Southeast Valley. We had about 5%, and then 27.8% in 2019. So it definitely changes across years, across time, as well as across space, the presence of COXY. So how does I'm just going to run through a few different things here too, and hopefully we can answer some additional things with questions. But asking a few questions. How does air surveillance relate to dust storms? So that question came up. We did look at the NOAA storm event database. It's not a perfect database. I have some other data I could show where we went out and ground truth the actual findings of dust storms that were reported in this. But each one of these dotted lines across time here represents when a dust storm, however that's calculated, showed up in the database. And then the line we're seeing here is actual case rates. Each individual color is a different portion of the Phoenix region. They all generally follow the same trend. We did some analysis, did not find that we're seeing an increase in prevalence, whether or incidence of COXY based off of dust storm, the related dust storm versus when we didn't have dust storms. So really no statistical difference, but this is still a fairly limited data set, but looking across this period of time. And part of that is right now we're getting resolution we haven't been able to get before. We can actually look at dust storms, where they occur in which parts of the valley, and as well as then the presence of COXY on these filters. How does air surveillance relate to clinical cases? Okay, so now if we're looking at the filters and the clinical cases, we did not see, during this time period, we did not see obvious seasonality for filters being positive. We did see this really large documented increase in cases, unfortunately, in 2017, late 2017. There's the right button. And that is, unfortunately, during a time period we didn't have a whole lot of the filter data. We can't really talk about what was maybe going on with the filters during that time period, unfortunately. But we are starting to now look at what may be driving this, doing some binomial mixed effects models, and I'll show you some of this data where we're actually now looking at we're able to look at the coccidioides presence absence versus cases over periods of time. So how far after we have presence on filters do we start to see cases or see changes in cases? And then comparing that to essentially, I think down the bottom, it's 0, 4, 8, 12, and 16 weeks. We actually have a much shorter time period for those first 8 weeks too. We don't have that data finalized yet. But what we were hypothesizing is that we would actually see, some positive association with clinical cases. We actually see a negative relationship, which maybe that's meaning that we're missing a potential positive association right here from between 0 and 4 weeks. That maybe it's up here. We don't know because the data's not on here. But we do see the further you get away from positive filters, the lower the number of cases. How does air surveillance relate to daily weather? So here we looked at a large number of variables. We've shrunk it down to just a few on here, the only ones that were that provided some interesting information, especially based off of the hypotheses that we had initially put in. But we did see a positive correlation with wind speeds. We saw a positive correlation. So this is wind speeds here. We saw a positive correlation with daily temperature as well. So obviously the warmer we were in this, the more we had positive filters, which doesn't necessarily relate to what we were seeing in the case data, what we were hearing about earlier, but it could relate to when cocci is getting up into the air, that the ground is drier, hotter, and therefore disarticulated arthrochonidia can get up in the air, which actually does get to where soil moisture was negatively correlated. So the wetter the soil, the fewer incidences we saw it on the filters, or the drier the soil, the more we saw on the filters. And then visibility was not at all correlated, interestingly enough, with coccidioides presence. And PM10 levels were actually negatively correlated. We don't understand that totally. It doesn't fit in with everything that's been looked at with PM10 before, because we don't know everything that drives PM10. A lot of that is smog. A lot of that is the winter inversion in the Phoenix region, where you do see a lot of particulates. That is, in some years where we see increased cases, some years we'd see decreased cases. So there's probably something within that data that makes sense, but we don't know what that is yet. And then, so conclusions right now. So this is all obviously very early analysis. One of the things is that we see this high variance of prevalence across space and time. And so we think that risk, therefore, is spatially and temporally variable. We do think that it is really important to know where coccidioides is in the soil. That's going to give a localized risk to individuals. So that's where we did see hotspots, but it's also got to be that soil's got to be disturbed, and we do see that changes across the valley. So there's a number of different drivers that are probably having an impact here. So last couple slides, I wanted to jump into this. So what does drive dispersal? I think this is really important, again, to think on both the micro and the macro level. A lot of these things have been discussed potentially as drivers: wind, these haboobs, natural disasters, climate change, and then potentially animals and humans, which I think are actually probably the most important thing here. So let me just give a couple thoughts. Wind clearly moves coccidioides through the air. We know this. And it can result in dispersed cases. So we can have outbreaks with wind moving cocci around. But I don't think that wind is actually causing dispersal of coccidioides. We know with some of the work that John Taylor and Matt Fisher did, and some of the things that we followed on by doing whole genome analysis, that we have very distinct phylogeography, which would state that you likely have independent, or you likely have limited dispersal events and then growth locally. So you have local populations which actually evolve separately from each other. If we have wind constantly moving this around, we wouldn't see this phylogeography. Climate change. So here's my perspective here, is that it can make the conditions more favorable for both growth and for transmission, getting it in the air, breathing it in. But I don't think it can disperse the pathogen. I think something else has to disperse the pathogen. And I'll come back to climate change in a second. Humans and animals, in my opinion, and others in this room too, are the likely long-range dispersal vectors. Again, some of the work from Fisher and Taylor early on showed that the populations in South America clearly came out of the Arizona populations and Mexico populations. We were able to confirm that, and we've seen the populations that are, that's likely occurred hundreds of thousands of years ago, from the genomic analysis. And then the populations that have moved northwards likely occurred thousands of years ago, and I don't know what that is. Oh, I'm not controlling it.
They're just locked up.
Oh.
Yeah.
Is it because my time ran out?
Actually, I think our network just dropped. There was audio issues too.
Oh, no. Okay. So let me just finish here. We don't need to see the final slide. But the populations that we've seen that really look at the northern part of the endemic region are not necessarily just expansion. We've seen the Dinosaur National Monument in Utah. There have been massive outbreaks in archaeology students in Northern California, and then now the population in Washington. I think those are independent dispersals by mammals, probably humans, maybe humans and dogs, because they occurred over the last thousands of years, but independent events. So when we have archaeological digs and we have these outbreaks, it doesn't mean that this is now a new expansion. It's what's happening is maybe what we're seeing is climate change is revealing where this has already been dispersed, and the conditions are now favorable for it to actually get into the air, which is what I think is probably happening in Washington State. I'll end there since I don't think my slides are working anymore.